The lower limb skeleton consists of different bones. The thigh region has the femur, while the tibia and the fibula they form the skeleton of the leg. Tibia and fibula work together to allow the leg to function properly. The tibia lies on the medial side and is longer than fibula. Tibia transmits the weight of the human body to the feet, while the fibula provides surface for the muscle attachment. The learning objectives for today's topic: at the end of the video, the student should be able to identify the bone tibia. The student should be able to describe the characteristic features of the bone. The student should be able to describe the different borders and surfaces of the bone. The student should be able to identify the orientation of the bone in the human skeleton. Okay, Bismillahirrahmanirrahim. Tibia. Tibia is also called as shin bone. It is the second most strongest and the longest bone present in the human skeleton. The most strongest and the most longest bone present in the human skeleton is the femur, and tibia is the second most longest and the second most strongest bone which is present in the human skeleton. The tibia is present on the medial side while the fibula is on the lateral side. The tibia is a weight bearing bone. It means that it transmits the weight from the knee joint to the ankle joint, and then the weight is transmitted to the foot. So tibia is actually the weight bearing bone of the lower limb, which is transmitting the weight to the foot, while the fibula provides surface for the attachment of muscles. Various joints are formed by the tibia. You can see in the figure, the tibia is forming a joint with the condyles of the femur. This joint is called as knee joint, also called as tibiofemoral joint. The upper end of the tibia articulates with the fibula to form the superior tibiofibular joint. Similarly, the inferior end of the tibia articulates with the inferior end of the fibula to form inferior tibiofibular joint. The tibia also articulates with the talus bone of the foot to form the ankle joint. So four joints are formed by the tibia: the knee joint, superior tibiofibular joint, inferior tibiofibular joint, and the ankle joint. The orientation site determination of the tibia. Now tibia is a long bone and it has basically three parts: an upper part, also called as upper end, a lower end, and a shaft. So how are you going to determine the side, whether this bone belongs to the right side of the human skeleton or the left side of the human skeleton? You should remember few points. You should memorize few points. The first thing is that the upper part of the bone tibia is expanded. Now we'll see this thing, the figure. Look into the figure. This is the upper part, and you can see the upper part of the bone is expanded compared to the lower part. Second important point is the anterior upper part has a bump, an elevation, which is called as tibial tuberosity. So the first thing is to identify the most expanded part, put it on the upper end, then identify a bump, an elevation. The elevation is present on the anterior surface of the upper part, and this elevation is called as tibial tuberosity. The third important point is that in the lower part there is a projection of bone which is called as medial malleolus. So when you look the lower part of the bone, there is a projection of bone projecting downward which is called as medial malleolus. This is called as medial malleolus. So when you will fulfill these three points, you will be able to determine the side of the bone. Now we will discuss the characteristic features of the bone tibia. We said it is a long bone, it has three parts, it has an upper end, it has a shaft, and it has a lower end. So you can clearly see in the figure, the upper end is also articulating with the fibula, superior tibiofibular joint. The inferior end is also articulating with the fibula, inferior tibiofibular joint, while the shaft is connected with the fibula by the help of the interosseous membrane. This is interosseous membrane. It is connecting the shafts of the tibia and the fibula. We are going to discuss these three parts now. The upper end of the tibia. Okay, when you look the upper end, it is large and it is expanded. So this region is the upper end, and you can see that it is large and it is expanded. It has two important eminences. They are called as condyles. It has a medial condyle and it has a lateral condyle. The upper end also has an intercondylar area. The area which is present between the two condyles, it is called as intercondylar area. It also has a bump and elevation which is called as the tuberosity. You can see this is tibial tuberosity. So there are four important characteristic features which are present in the upper end: the medial condyle, the lateral condyle, intercondylar area, and a tibial tuberosity. First, we will discuss the medial condyle. The medial condyle, this is the medial condyle, and you can see that the medial condyle is comparatively larger than the lateral condyle. Its superior surface has an oval articular facet to articulate with the condyle of the femur. So the superior articular surface articulates with the medial condyle of the femur. This is the anterior view of the medial condyle, and this is the posterior view of the medial condyle. When you look the posterior surface of the medial condyle, there is a deep transverse groove present. Now this is the deep transverse groove which is present on the posterior surface of the medial condyle of the tibia. In this figure, you can also see the superior articular surface of the medial condyle of the tibia. This is a top view, the superior top view of the tibia. In this, you can see the oval articular facet which is present on the upper part of the medial condyle of the tibia. This is the medial condyle of the tibia, and you can see this is the oval articular facet. It articulates with the medial condyle of the femur. Now this is meniscus. This is medial meniscus. The medial meniscus is attached on the peripheral margin of the articular facet. See over here, this is medial meniscus. Menisci are actually pads of cartilage which are present in the knee joint. So the medial meniscus is attached on the periphery of the articular facet. The lateral condyle. The lateral condyle is smaller. It also has a superior surface. The superior surface has a circular articular facet to articulate with the lateral condyle of the femur. So you can see in the figure, this is the lateral condyle of the tibia. Its superior surface is articulating with the lateral condyle of the femur. The lateral condyle in the posterior inferiorly, there is a circular facet for articulation with the head of the fibula. So actually the lateral condyle has two facets for articulation, one with the lateral condyle of the femur and another with the upper end of the head of the fibula. It forms the superior tibio-fibular joint. This is the superior tibio-fibular joint formed between the lateral condyle of the tibia and the head of the fibula. This image is of superior or top view of the tibia, and in it you can see the circular articular facet which is present on the lateral condyle of the tibia. This is the circular articular facet present on the lateral condyle of the tibia, and you can clearly see that on the peripheries again the lateral meniscus is attached. This is the medial meniscus, and here you can see this is the lateral meniscus. The medial one, the medial articular surface or facet is oval in shape, while the lateral surface is circular. It is circular. This is the anterior view of the lateral condyle, and this is the posterior view of the lateral condyle. Now what you can appreciate in the anterior view, there is a slight elevation and eminence which is called as Gerdy's tubercle. So its the anterior surface of the lateral condyle has an eminence, and this eminence is called as Gerdy's tubercle. It is called as Gerdy's tubercle. When you look the posterior inferior part of the lateral condyle, it has a flat facet for articulation with the head of the fibula, as it was discussed in the previous slide. So you can see clearly the posterior view of the lateral condyle and the articulation of the head of fibula and the lateral condyle of the tibia to form the superior tibio-fibular joint. The anterior surface of the condyles. When you look the anterior surface of the condyles, they are continuous with one another and they form a large flattened triangular area which ends at the tibial tuberosity. The posterior surface of the condyles. Posteriorly, when you look the condyles, they are actually separated from each other by a shallow depression. This depressed area is called as the intercondyloid fossa. The intercondyloid fossa separates the two condyles posteriorly. The tuberosity of the tibia. The tibial tuberosity is a large oblong elevation. It gives attachment to the ligamentum patella. Now you can see in the figure, this is the patellar ligament which is attached on the tibial tuberosity. It is attached on the tibial tuberosity. The intercondylar area. Intercondylar area, it is located between the articular facets. You can see these are the articular facets, and the area which is present between the two articular facets, this area is called as intercondylar area. The intercondylar area has two tubercles, a lateral intercondylar tubercle and a medial intercondylar tubercle. This is the medial intercondylar tubercle and this is the lateral intercondylar tubercle. The intercondylar area, when you look at more clearly, anterior and posterior to the tubercles, there are depressions which are called as anterior and posterior intercondylar areas. So this part, this region is the posterior intercondylar area and this region is the anterior intercondylar area. This is anterior intercondylar area and this is posterior intercondylar areas. These are actually depressions present anterior and posterior to the tubercles. These areas provide the surface for the attachment of cruciate ligaments and for the attachment of the menisci of the knee joint. Now in this figure you can see the red marks, they are for the attachment of cruciate ligament. This is for the anterior cruciate ligament and here this is the attachment of posterior cruciate ligament. The blue marks are for the menisci. This is the anterior end of medial meniscus and you have the posterior end of the medial meniscus. Similarly, on the lateral side, there is attachment of anterior end of the lateral meniscus and this one is the posterior end of the lateral meniscus. So you can very clearly see the intercondylar area is providing a surface for the attachment of the menisci and the cruciate ligaments. You can see in this figure, this is the cruciate ligament and this is the menisci, the lateral meniscus and the medial meniscus. They are attached on the intercondylar areas. Okay, Ji. So we have completed the upper end. Now we are going to move to the shaft of the tibia. In the upper end, we said there are four features: a medial condyle, a lateral condyle, a tibial tuberosity, and the intercondylar area. Now we are moving towards the shaft of the tibia. The shaft of the tibia is the middle portion which is present between the upper end and the lower end. It has three borders: anterior border, medial border and interosseous border. All these three borders we are going to discuss in the next slides. So the first border is the anterior border. Anterior border, it is the most prominent border. Now when you look at the tibia, this is the anterior view of the tibia. Okay, so the most prominent border is the anterior border. It starts, we are going to trace this border. It commences, or you can say it starts above at the tibial tuberosity. It runs downward slightly obliquely. You can see it is going towards the back now, and it ends below at the medial margin of the medial malleolus. So this obliquely present border, which is the most prominent one, this is called as anterior border. It is starting from the tibial tuberosity running downwards, slightly obliquely, going back up to the medial margin of the medial malleolus. This is anterior border. Now the anterior border, it says it is subcutaneous and it forms the shin. The second border is the lateral border, also called as the interosseous border. Now we are going to trace the lateral border. Lateral border, also called as interosseous border, because you know interosseous membrane is attached over here. This border extends from the lateral condyle down up to the anterior border of the fibular notch. See, we are running downward and this border is the lateral border. Fibular notch. Now, fibular notch is actually a facet, an articulating facet which is present on the lower end of the tibia. This is called as fibular notch, on which the lower end of the fibula articulates. So lateral border is very simple. You have to trace it downward from the lateral condyle of the tibia down up to the fibular notch. Then you have the medial border. The third border is called as the medial border, and you can see over here it extends from the medial condyle down up to the posterior border of the medial malleolus. It will move down, 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 and it will go back. It will go posteriorly down up to the. It will go down up to the posterior border of the medial malleolus. So to trace the medial border, again it is very simple. You have to start from the medial condyle. You will run downward up to the posterior border of the medial malleolus. This will be the medial border. Now there are three surfaces which are present in the tibia. Is a lateral surface, there is a medial surface, and there is a posterior surface which will be seen in the posterior view. So first we are going to see the lateral surface. Lateral surface. Now the lateral surface lie between the anterior and the interosseous border. So when you look into the figure, this whole part, this whole surface which is present between the anterior border and the lateral border, it is called the lateral surface. This is all the lateral surface of the tibia. Now it says that in its upper 3/4 it is concave and is directed laterally. See, it is directed laterally in its upper part, while in its lower 1/4 it is directed forward. Very true, because the anterior border is oblique, hence the lateral surface in its lower 1/4 is facing forward. This is all the lateral surface which is highlighted by the yellow highlighter. ठीक है जी, आगे चलते हैं. चलें. The second surface is the medial surface. See over here, this is the medial surface. Now it is present between the anterior border and the medial border. Oh gee, there is a mistake over here. This is not the interosseous border. You have to correct it. This is medial border. I'm sorry for this error, human error. It is present between the anterior and the medial border. ठीक है? So this surface is called as the medial surface. The medial surface is subcutaneous in the upper 3/4. This is all the medial surface and it is subcutaneous in the upper 3/4. The last one is the posterior surface, and the posterior surface is present between the medial border and the interosseous border. When you look the posterior view of the tibia, you will find the surface present between the medial border and the lateral border. This whole surface is called as the posterior surface of the shaft of the tibia. The posterior surface is widest in its upper part. It is widest in its upper part. Now when you look the posterior surface, it has a line which is called as soleal line. Now look into the figure. The soleal line is actually a rough ridge that crosses the posterior surface of the shaft of the tibia. This is soleal line. It is crossing the posterior surface of the shaft of the tibia. The soleal line runs downward and medially. Look the direction of the soleal line. It is running downward, it is running downward, and it is running medially from the fibular facet. This is fibular facet. It is running downward from the fibular facet up to the medial border of the tibia at the junction of its upper and middle thirds. This is the upper one third, this is the middle one third, and this is the lower one third. So soleal line is actually running downward and medially from the fibular facet down up to the medial border at the junction of its upper and middle thirds. Okay, when you look the posterior surface, above the soleal line, the surface is triangular. See, above the soleal line, the surface is triangular, while below the area present below the soleal line is divided into a medial and a lateral part by a vertical ridge. Now look into the figure. This is the vertical ridge which is dividing the area below the soleal line into a medial and a lateral area. The posterior surface of the shaft of the tibia has a nutrient foramen. This nutrient foramen transmits the nutrient artery, which is a branch of the posterior tibial artery. So this is the nutrient foramen through which the nutrient artery enters to supply the blood. It is a branch of posterior tibial artery. Okay, we have completed the shaft. It had 3 borders, 3 surfaces. Now we are going to move to the lower end of the tibia. This is the lower end of the tibia, having a most important feature which is called as malleolus, the medial malleolus. The lower end of the tibia, it is expanded but lesser than the upper end of the tibia. It is expanded but less than the upper end of the tibia. It has a downward projection on the medial side which is called as medial malleolus, the most important feature which is present over here. This is the medial malleolus, which is a downward projection. When you look the lower end, it has 5 surfaces, but these are very simple. You don't have to worry about it. It has 5 surfaces. This is the anterior surface of the lower end. The anterior surface has an upper smoother part and a lower rough and a grooved part. This is the lower rough and a grooved part, and the upper surface is quite smooth. It has a medial surface. The lower end has a medial surface, and the medial surface is subcutaneous and is continuous with the medial malleolus. The medial malleolus is a strong process projecting downward. It is an important subcutaneous anatomical landmark. The medial malleolus is an important anatomical subcutaneous landmark. The lateral surface of the lower end presents a notch which is called as fibular notch, to which the lower end of the fibula is attached. Now this is the fibular notch to which the lower end of the fibula is attached. So we said that the lower end is how many surfaces? It has 5 surfaces, right? You don't have to confuse them. This is anterior surface, and we said it has a smooth part and it has a rough part. It has a medial surface which is continuous downward with the medial malleolus. It has a lateral surface which has a fibular notch. The inferior surface of the lower end is articular, and it articulates with the talus bone to form the ankle joint. So this is important. The inferior surface of the lower end is articular. It articulates with the talus to form the ankle joint. Medially, the articular surface extends up to the medial malleolus. This you can see the inferior surface of the lower end of the tibia is articulating with the talus to form the ankle joint. The posterior surface of the lower end has shallow grooves. Now this is the posterior surface of the lower end, and you can see it has grooves for the passage of tendons of muscles, flexor hallucis longus, flexor digitorum longus, and tibialis posterior. So these 3 muscles pass just from the lower end of the posterior surface of the tibia, and there are grooves present over here. This is the posterior surface of the lower end having grooves for the tendons of tibialis posterior, flexor digitorum longus, and flexor hallucis longus muscle. Okay, ji, alhamdulillah, we have completed the osteology of tibia. Now this is a summary for the tibia. We said tibia is called as shin bone. It is present on the medial side. It is the weight transmitting bone of the leg. It has 3 parts: an upper end, a shaft, and a lower end. Okay, the upper end has a medial condyle. This is the medial condyle. अब मैंने कैसे कहा कि ये medial condyle है? Because I have seen over here, this is the medial malleolus. So it means medial condyle. It has a lateral condyle. It has a tuberosity which is called as tibial tuberosity, and an intercondylar area. The medial and the lateral condyle have articular surfaces, and they articulate with the medial and the lateral condyles of the femur. The shaft of the tibia, it has 3 borders and 3 surfaces. The border which runs downward from the tibial tuberosity obliquely up to the medial margin of the medial malleolus, this is anterior border. The one which runs downward from the medial condyle, this is this is medial border. The one which runs downward from the lateral condyle, this is lateral border. It has 3 surfaces. It has 3 surfaces, right? It has a medial surface. This is the medial surface. It has a lateral surface, and it has a posterior surface. The posterior surface has an important line which is called as soleal line, which divides the posterior surface into an upper triangular area and a lower elongated area. The elongated area is further divided into a medial and a lateral parts by the presence of a vertical ridge. The lower end, we said it has 5 surfaces: anterior surface, a medial surface continuous with a medial malleolus, lateral surface having a fibular notch, inferior surface articulating with the talus, and a posterior surface which has grooves for the passage of tendons. So there is a small quiz for you. You have to identify this point, this region. Now, can you please identify what structure I have marked over here? Actually, it is very simple. This is, bata do. This is tibial tuberosity. Identify this projection which is present in the lower end.